Today we'll be learning about generating awareness on the rational use of medicines. We will be covering generating awareness to the general population, generating awareness to the patients, and public education campaigns. So the one of the significant reasons for irrational use of medicines is a lack of awareness and improper understanding of medicines and how they are to be used among the general public. Most often, the physicians and healthcare professionals will not have sufficient time to inform the patients about the use of medicines. So, an effective public education can lead to enhanced adherence to the prescribed medications, and it can also reduce the self medication practices and improve the safety for the patient. The main methods of creating awareness in the general population is through mass media campaigns, health education programs, community outreach programs. And for all of these, it's important to involve the healthcare professionals when you're creating awareness among the public. And it's also noteworthy that regulatory authorities' role in monitoring and enforcing the rational use of medicines is also important. So, for any educational information to be provided to the general public or to the patient, the route of administration is one of the important things. So, we have different types of routes through which drugs are administered. Oral, which is the most common form, it includes tablets, capsules, or sometimes liquids. They are easy and convenient to administer. And the topical preparation, which are applied on the skin, like creams, ointments, or transdermal patches, and injections, which are also called as intravenous route, where the drug is delivered directly into the veins, and which allows for a immediate action of the drug. And then an inhalation, where drugs which are specifically meant to reach the lungs are delivered through the use of nebulizers as well as inhalers, especially for respiratory diseases. And also any subcutaneous injections, which are these are drugs that are injected just under the skin, and they are not injected into the arteries or the veins. So these are some of the common routes of where most of the medications are administered, and depending upon the type of medication and the route it is administered, it is important that these are awareness to the public about these is brought about. Then the second thing of importance is the dose of the medications. So it's important for a person to know what is the recommended dose based on a person's age, weight, or the severity of the condition. And sometimes nowadays we go for precision medicine or individualized dosing. So depending upon the patient's individual characteristics, and it is important to adhere to the prescribed dose to ensure that the therapeutic effect is achieved, and you also minimize any risks of overdosing. And it's also important, especially for chronic diseases like epilepsy, to mention that the doses will not be constant over the period. They need to be titrated. Sometimes it involves gradually increasing the dose, or sometimes decreasing the dose over time, and with continuous monitoring to ensure that the therapeutic effect is reached. So, this approach of titration is also aimed at minimizing the adverse effect and maximizing the therapeutic efficacy. And it's also important to inform the patient about the maximum daily dose, especially for drugs like drugs used to treat pain, so that you know that you don't take more than what is recommended. If the patient takes more than what is recommended, then it leads to severe adverse effects or toxicity. And also, it's important to mention that the doses are not same for everyone, and especially for special populations like children and very elderly, like 65 years and older. The dose might not be the same as that of an adult, and they will require some dosage adjustments because there are some changes in the metabolism or in the function of the organs, or maybe their sensitivity or their response to the medications. And also, it's important to mention that the doses will change if there is some kind of organ impairment, especially the renal impairment or hepatic impairment. Because these two organs play a very important role in metabolism and elimination, so any dysfunction can affect the levels of the drug in the body. So, modifying these doses will again help in increasing the therapeutic benefit as well as decrease the toxicity. Then the third thing that about any medicine that has to be informed to the general public is the storage. So first is the temperature. So you need to tell them whether it should be stored at room temperature, or some certain injections and other medications need to be stored in temperatures less than 15 degrees. So you will have to tell them that this needs to be stored in a refrigerator. And again, certain medications, they get degraded when exposed to light, and the pharmaceutical manufacturer would have used opaque containers, or they use dark colored packaging to prevent the light from getting inside or touching the medication. But still, it is important for the patient also to know that he should follow the storage instructions properly, otherwise the potency of the medication is lost. Then again, especially in cold places, some of the drugs which are they can get degraded because of the moisture, especially tablets and capsules. They can change color, uh, or they can get degraded. So it is important to store the medications in a dry environment and avoid exposing them to any excess moist conditions. And also, especially in households where there are children, uh, are packed in child-proof containers so that accidental ingestion is prevented. And these kind of containers have some safety features like, push and turn caps, so that a child does not know how to operate that. So this is for ensuring the safety of the child. And some medications may interact with another if they are stored together. So it is important to store medications separately to prevent cross contamination or even degradation. Then another important thing that has to be informed to the patient is about the adverse drug reactions to a drug, and contraindications, any drug-drug interactions, and any specific warnings. ADRs, or adverse drug reactions, these are unwanted effects that occur for a medication that is used in a normal dose. So they can range from, mild, like, just dizziness or drowsiness, and nausea, and there can be a severe allergic reaction, or sometimes it can even result in a damage to the organ. So, especially for toxic drugs which have documented adverse drug reactions, it is important that the patient be aware of what are the potential ADRs, and then report them to the healthcare professional if they experience them. And any contraindications, so these are conditions or situations where a medication should not be used because the risk is much more than the benefit of using the medicine. So some of the examples like allergies, allergic to certain components used in the formulation, or certain drugs are best avoided, or they are not to be given in a pregnant woman, or in certain conditions. Especially if they are also taking some other drugs, so it is important for the patient to know what are the contraindications, and so that he or she stops whatever medication he is taking before starting this drug. And drug interactions, so these are interactions when two or more medications are given together. It could be a drug drug interaction or a drug food interaction. Sometimes when a medication is taken with food or alcohol, they can interact and alter the effects. So these effects can be decrease in efficacy or increase in the toxicity, or some reaction which is unpredicted. So it's important for the patients to know that they give all these information to the doctor when they visit him, so that these kind of any drug interactions can be identified and avoided by the patient. And warnings, so some of the medications can come with warnings with for specific risk, or you can say it's a precaution. Usually they are informing the patient about potential side effects, especially if it is taken by a child or the elderly, or any specific monitoring that is required during treatment. So patients should read the warnings to ensure the safe and effective use of the medication. And also, certain medications require additional precautions for special populations. So the special populations are the pregnant or breastfeeding women, pediatric population of children, and the elderly. So these warnings, uh, they should mention about what are the risks to the fetus or the infant if it is breastfeeding, and also help the patients make a better choice whether to take the drug or not. So, generating awareness to the patients. So, the patient centered care involves active participation of patients. And this is what we call as a shared decision making. So, especially if there are choices that a patient has, then it is important to inform the patient of the choices and inform what are the advantages and disadvantages of each of the choice, and help the patient make a decision. So this involves active participation by the patient, and he or she understands the risk of one treatment versus another. Especially this works when there are multiple treatment options. And by using the shared decision making, the knowledge of the patient is improved, and there's a better understanding of the risks. And also, during discussions, when we are talking about the treatment to the patient, their values and beliefs also come into the discussion, and that is also considered before prescription. And also it's important for pharmacists, because they are, you can say, the primary contacts for the patients where medicines are concerned. um, and especially where when a patient has to take over the counter medications, because the pharmacists are knowledgeable, they can help make a better decision by the patient based on their symptoms or their current disease states and what other medications they are using. So, as a pharmacist, not only promoting sales is important, it is also important to emphasize adherence to both the prescribed medications as well as any over the counter medications that the person takes. Coming to public education campaigns, uh, while performing any kind of campaign like this, pharmacists can help by making a list of the approved OTC products, uh, or if any product is contraindicated or not approved for patients with certain conditions, especially for heart conditions. So they can make and they can use the information about the patient, like any medical history or family history and any current medications that the patient is using, uh, to help the patient use the best drug. And also in clinics, especially in a heart health clinic, it's better if the patients are warned against using certain OTC cough and cold medications, because they can increase the blood pressure as well as the heart rate, and that can worsen their heart condition. And also, not only avoiding drugs, you can also recommend certain products which are good for the patient, like niacin and omega 3 fatty acids, which have an overall improvement in the lipid profile. Okay. And taking fiber, okay, and any other substance that can be considered as a supplement and which has proven benefits. And one of the thing with public health campaigns is they require more funding and human resource for implementation of the campaign. And whenever a public health campaign is planned, it is better to realize that the results will be seen over a long period of time, because the campaign itself will run for a longer period. So it is also important that the campaigns try and put in some solutions for the issues that they are trying to tackle with. Um, so appropriate use of medications, if we are talking about that, we should demonstrate that and explain the risks that a individual is exposed to if a dose is missed or if the dose is alternated. And also, it is important to dedicate enough time to the campaign and information transfer. So what kind of information do you need to provide to the public? So that a lot of thought must go into that, because and then only you can expect any kind of behavioral change from the community. So what is the information that you're going to provide, and how are you going to provide it to ensure that the maximum benefit is obtained by the participants? And also, when you are assessing public health campaigns, it is very difficult to measure the outcome of a public health campaign, because many times the participants may move elsewhere, so you cannot locate them. And for these kind of reasons, especially for public health campaigns which run for a long period of time, it is difficult to actually measure the outcome. And also, um, for a public health campaign, you should have some pre and post assessments to avoid any bias. So for that you need manpower, so that is why we require more funding and human resource. So these kind of pre and post assessments are the ones which will answer the questions that we have raised truthfully. So this is an example of a public education campaign that was done in Navi Mumbai, in some sectors in the Nerul region of Navi Mumbai, and the investigators had selected a few sectors, and they wanted to see the impact of education on the knowledge, attitude, and practice regarding the rational use of medications. So they had chosen 54 households in the intervention group and 60 in the control group. And they found that the intervention group which received prior education, they had a improved awareness, especially with regards to the correct knowledge of generic medicines, and drug use in pregnancy and lactation as well as in children, and precautions to be taken in case of renal and hepatic disease, and generally what precautions should be taken during antibiotic use. So all these things was observed when they visited these 54 households and intervened. And they had kept one household informant who has a major understanding of the health of the people in the house. So they summarized that this information brochure that they had prepared as an educational material proved effective in enhancing the knowledge as well as promoting rational medicine use. And they have also referred other reports like this in literature. So the take home messages is to improve medicine use by the general public, and awareness and understanding is very important. And also the type of information about the medications to be given should be given a lot of thought. First is the reason for use, what is the route and what is the dose, how do you store the drug, what are the common adverse drug reactions, and what are the contraindications if there is any. And there are various methods of creating awareness. You have mass media campaigns or health education programs or community outreach programs, and also periodic regulatory information, especially if there is some regulatory change that has occurred for a product. So that kind of information must reach the public. And it's also important to involve healthcare professionals whenever these kind of campaigns are conducted. And as always, continuous assessment and monitoring of any kind of awareness program is important to assess. So the monitoring or the assessment should even eventually see how many decreased drug-induced hospital admissions have occurred because of these public education campaigns, and how many decreased medication errors or toxicities or medication toxicities at the household level. So all these things can be assessed for a education campaign. Thank you.